We've all been washing our hands our whole life, but how effective is your hand washing technique? By the end of this introduction, we will show you a video to guide you through the steps of hand washing to make sure your hands are thoroughly clean.
Washing your hands properly removes dirt, viruses, and bacteria to stop them spreading to other people and objects.
Remember, washing your hands is one of the easiest ways to protect yourself and others from illnesses.
To wash your hands to eliminate microorganisms, we should wash our hands for 20 seconds. There are 10 steps for washing your hands, so pay attention. So here is a video about hand washing technique, step by step, as we promised.
Step 1. Wet your hands and apply soap. Step 2. Rub your palms together. Step 3. Rub the back of your hands with your palms, first the right one and then the left one. Step 4. Interlock your fingers and rub your hands well. Step 5. Cut your fingers and rub your cup palm with the opposite hand. Then swap.
Step 6. Close your left hand with your right thumb and rub well, then swap. Step 7. Rub the tip of your fingers over your left palm and then swap. This way, we clean away dirt that may have been left under your fingernails. Step 8. Rub around your wrist with the opposite hand, then swap. Step 9. Rinse soap off your hands. And finally, step 10, the last one. Dry your hands with a clean, dry towel. Now our hands are clean.
Oh, a piece of advice. Don't cover your mouth with your hand when you cough or sneeze. Instead, sneeze into your elbow. Most germs are spread through the air by sneezing and coughing. Germs can also spread in sweat, saliva, and blood. Some pass from person to person by touching something that is contaminated, like shaking hands with someone who has a cold and then touching your own nose.
Steering clear of the things that can spread germs is the best way to protect yourself, and that means hand washing. Protecting ourselves so that we can continue to help others is a priority for healthcare providers around the world. This includes being conscious and up to date with infection prevention and control measures.
In addition, an appropriate implementation of personal protective equipment, however, hand hygiene and waste management.
PPE stands for Personal Protective Equipment. And is equipment worn to minimize exposure to hazards that cause serious workplace injuries and illnesses.
As we can see here, this picture shows all the personal protective equipments. So the components of PPE are gown, goggles, respirator mask, gloves, shoe cover, head cover, face shield and eye protection.
Let's go and see how to don PPE step by step. First of all, perform hand hygiene with either an alcohol-based hand sanitizer or soap and water. If using an alcohol-based hand sanitizer, remember to allow the sanitizer to dry completely before moving into the next step. Then, put on your gown, making sure that the gown fully covers your body when closed or tied and does not slip down off your shoulder.
Next, put on the respirator mask. Hold the respirator in one hand and bring to your face. Pull the lower elastic band over your head and below your ears. Pull the upper elastic band over your head and above your ears. Press the nose clip to ensure a tight seal of the respirator to your face. Make sure you do not feel any leaks around the respirator. Remember to avoid touching your face.
Next, put on your eye protection. You can use either a face shield or goggles. Then, perform hand hygiene. Finally, put on your gloves, making sure that the gloves go up and over the cuff of the gown.
Duffing PPE. Duffing PPE is the time that you are at highest risk of contamination. Remember, your gloves, face shield, and sleeves of your gown are contaminated.
Start by taking off your gloves. Grasp the gloves in the palm of your hand and slowly pull the glove off. Discard the glove in a waste container. Slowly and gently slide a finger under the other glove, between the glove and the cuff of the gown, and slide the glove off. Do not touch the contaminated cuff or outside of the glove. Discard the glove in a waste container.
Perform hand hygiene. If using a face shield, tilt your head forward, grasp the strap and gently pull the strap over your head, pulling the face shield away from your face. If using goggles, tilt your head forward and grasp the earpieces above the ears and pull the goggles away from your face. Discard the face shield or goggles in a waste or reprocessing container.
Perform hand hygiene. Slowly and deliberately remove your gown. Avoid touching the outside contaminated surface of the gown, as well as your face.
If you are using a gown that ties in the back, untie the gown. Pull the gown down from your head and away from your body, and touch only the inside surface as you pull the gown off. Gently rub the gown into a ball with the contaminated surface inside the ball. Discard the gown in a waste container. Perform hand hygiene.
With your respirator still in place, leave the patient room and enter the interroom or the hallway. Remove your respirator by gently pulling the lower elastic band over your head. Then, gently pull the upper elastic band over your head and pull the respirator away from your face. Make sure you don't snap or fling the respirator. Discard the respirator in a waste container.
Finally, perform hand hygiene with either an alcohol-based hand sanitizer or soap and water. Thank you all for your time and attention. Don't forget to don and doff your PPE properly and correctly to protect yourself and others from spreading infection. This video was directed by Sir Mahmoud Al Zayud and done by Shamma Rashid and Al Anud Ali.